obviously, the healthcare bill that the Republicans are trying to pass is a disaster. It's going to kill people. And thank you for reassuring us the senators will pass it. Senator Sanders and I believe Senator Franken are, thank you. Senator Sanders and Franken, I think, are about to introduce a single-payer Medicare for All bill into the Senate. And I would like to know, are you planning to sign on as a supporter of that bill?
We are looking at it. I'm the lead sponsor of, and the author of the public option bill. And they're not truly inconsistent with one another, but the public option is one of the steps on the way to, I think, single payer. There was an interesting moment that I'm sure you noticed when the president had either the president or the prime minister from Australia visiting, and he said in front of the press, you know, we have this terrible, terrible healthcare system in America. It's nothing like yours. In Australia, you've got a really good healthcare system. Well, Australia has a healthcare system that is single payer. It's basically Medicare for everybody. I don't know if he didn't know that, or if that's the way that he should go. In his heart, he knows that that's a good way to go. Clearly, one thing is true. If you look at all of the single payer systems that virtually every country that we compete with economically has, and you look at how much their healthcare systems cost them, you look at all of them and you pick the most inefficient and expensive per person of them all, we are 50% more expensive than that. And if you take the average, we are 100% more expensive than that. So then you think, well, if we're paying 50% more than the least efficient one, or 100% more than the average, we must be getting really super great care for all that extra money, right? But then you look at measures like life expectancy, and we are competing with Greece and Croatia. Australia has us really beat. So we have huge, huge opportunities to move in a really good direction on healthcare, and I think the direction of single payer is the right direction. There is a step that I think needs to take place, which I think is a public option so everybody can get used to the idea. If people have Blue Cross through their job, to go to them to say, that's all gone, we're going to do something new, is going to create a very big reaction. And I think we've got the wedge in the door, to me, is the public option. So as to their direction, that's the way we need to go. We need to make this a lot more efficient. Whether you do the English system or the Swiss system, it's all single payer, even if there are different elements in between. And we just can't afford the healthcare system that we have right now with all of its inefficiencies and having so many different bureaucrats and CEOs and companies that all need to make profits out of the system before you get your healthcare. So more to come on that.